you have a book, and I'll just drop it right now in this conversation, Dr. Stone. You're the author of Save Every Life You Can, a reflection on leadership and saving lives during the COVID-19 pandemic. I just want to say, first of all, I never thought I'd read that title, okay? Or live through such an event myself and have to, as a business owner, abide to all the rules that were being put out there to us by our state and federal guidelines, CDC, everybody coming in with 2 cents on the pulpit saying this and that. And here you are with the U.S. in front of your name, realizing you have all of these men and women underneath your command, if you will, that need to be saved and protected while losing staff members. I believe, if I did a little research, around 150 people of what I read, you lost as staff members in the VA just from COVID, just that disease attacking them, that virus, and taking their lives. These people who were just there to do the volunteer work. They were veterans, people helping, caregivers bringing their pets in to let veterans pet them. COVID hit those people and took them from our lives and their families' lives. And here you are, 19 million people, 8 point something million of them coming into the VAs to get service. They need it. They got to have cardiologists. You got to have heart surgery still, but no, it's all halted. Everything's being halted, non-major surgeries. What's going through your mind, sir? I mean, here you are.
Look, I came to the VA thinking that I needed to fix the access to healthcare problem, and I ended up doing something that nobody done for 100 years, and that is to lead America's largest healthcare system through a once in a century pandemic, one that completely overwhelmed our healthcare system, overwhelmed our supply systems, and challenged us as significantly as the 1918 influenza pandemic that began in the United States Army and cost so many millions of lives around the world, maybe as many as 50 million lives. Little did I know that more than 2 million Americans would lose their lives to the COVID pandemic. What was going through my mind was as follows. I was put there for a reason. I've always trusted that God put me wherever I was supposed to be for a reason. I was the only combat experienced veteran to lead this organization in 30 years. I'd led soldiers in combat. I'd lost soldiers in combat. I was there for a reason, and we built the organization in order to be flexible and agile enough to take this on. There are 950,000 hospital beds in America. In those 950,000 hospital beds, they're about 85 to 90% filled all the time with Americans that need health care. So you can pretty quickly figure out that you don't have a lot of health care beds available. And we were thinking that as many as 100 million Americans might get COVID very quickly. And of those 100 million Americans, we might need somewhere between 10 and 15 million hospital beds when we only had 125,000 to offer. My job, representing 25,000 hospital beds in my system, was to focus on the patients most in need. So we focused the system on the most critically ill patients. And if you remember, in March of 2020, when New York was screaming for help, most of that help was needed in southern parts of New York and Manhattan and the Bronx and the boroughs of New York City. And they needed a lot of help. And that was the first place that we began accepting civilians into our system. Now, we needed to do that by taking the most critically ill patients that needed the most support. And our job was to unload the civilian system while still maintaining the ability to support veterans, even the 9 million veterans that hadn't come to us. Our feeling was when their own healthcare system was overwhelmed, they were going to turn to us. We needed to create room. So we grew our system by 4,000 beds. Now, you opened this discussion with a discussion of Salt Lake City and the mile-long hallways.
Right.
Those mile-long hallways were what allowed us to reconfigure the VA to literally, within a period of weeks, grow 4,000 critical care beds. and to take very critically ill patients off the hands of many of the civilian hospitals. And let me give you an example of that. After Katrina, um, our hospital in New Orleans was destroyed. We rebuilt that hospital, and when we rebuilt that hospital after Katrina, we built it so it was ultimately configurable. And literally, in a period of 72 hours, the hospital leader in New Orleans, when he realized that the New Orleans hospital system was being overwhelmed, converted that entire hospital into a 100-bed ICU.
Wow.
And we were able to fill that with critically ill patients and save as many lives as we could. And that's where the title comes from, of Save Every Life You Can.
Right. And again, let me just reiterate what the title of that book is, because there's a lot. It's a sentence. It's Save Every Life You Can, a reflection on leadership and saving lives during the COVID-19 pandemic, written by General Dr. Stone here, okay, Undersecretary for the U.S. The guy knows what he's talking about. You should check this book out. Just open up your mind and see what his mind had to deal with and what he wants to talk about, and read about that and check it out. I'm sure that it'll be a part of our book club. SOFREP has a book club that we do, and I'm sure Brandon would love to throw that into the rotation. Those of you that are a part of our book club listening, we do a book club, SOFREP book club. Check it out. But I just want to put that out there. Love to have it in the rotation. We have about 1,000 books in our book club that we generate through our members. Now, here I am. I just get to sit in front of a fire and host a podcast, and you're sitting here running as a commander. You have so much on your plate. What is it that you do do you do Tai Chi? Is that what it is that you find? Like, if you got 30 minutes to do something and step away, take a beat, what is it that you go and do?
Yeah. I've always believed I'm in a marathon, not a sprint, and I need to measure myself. And part of measuring yourself is to find balance, and that balance includes demonstrating the ability to go home and sleep at night. I love exercise, and I love to bike ride. And in the winter months, I stationary bike. I'm a Peloton guy, but I love to kayak. And love to horseback ride. And so, I think there's things you do to find balance, but I think what you expect of your leaders, and I led 363,000 people through the pandemic. When I was in the uniform services as a deputy surgeon general, there were 60,000 people that worked for me. I think you find balance by always recognizing the fact that you're not the smartest guy in the room. You need your whole team to help you through whatever challenge you have. And you must remain the calm in the center of the storm. When people were in meltdown of, oh my gosh, we're going to be overwhelmed, and the entire country's going to be overwhelmed, you had to take a step back and say, we're going to save people one life at a time.
That's right.
And your opportunity is to do the same thing that you did when you were in the service. And that is, you had a lot of big responsibilities, but you took care of the person to your left and to your right. And that's what you took care of as you narrowed your focus. And I remember the first time I was fired on in combat. It was amazing, the narrowing of focus that came down from all the worries I had to simply survival from the engagement and survival of the people that were just around me. And I think those are unique experiences. And I can't tell you how important I think that was to my success as I was able to put a team together that did some pretty extraordinary work as it worked its way through this once in 100-year event. And so, Red, what do I do? I try to always remain as humble as I can. Always focus on the fact that my job is to be the calm pillar in the center of that storm.
Calm pillar. See, I take notes. I do. I have notes. Calm pillar. Let me write that down. I think we were just talking about lighthouse earlier. Remember that? We had a little lighthouse conversation. I was like, I don't want to toot my horn. Calm pillar. So as a calm pillar, and finding your own zen because you're human. I know you got rank. I know you got stars. You got cars with flags on them. You got details following you everywhere. You're an important individual in that job and that role. But at the end of the day, I'm sure you have a family life, a support system that's there on the home front for you. Am I right?
Mm-hmm. Yep.
And they're there to support you through, like, when everybody comes to you. My mom would always say, who do I get to go to? Who do I go to vent? Everybody goes to mom. Right? Everybody's coming to you to vent, and it's like, who do you go to vent? Do you go up the chain, right? And so do you feel that you had, since you're out now, do you feel that you had a viable chain of communication, or excuse me, let me start over, a clear line of communication with your chain of command that was above you?
Yes. I was blessed with a secretary, and Secretary Wilkie, who was a veteran. He understood exactly what I was talking. The first time I met him, I sort of laid out where I wanted to lead the VA, and he said to me, Dr. Stone, I'm not of your world. He said, I'm not a healthcare guy. He said, I have a pretty clear idea of what I want done and what I want done for veterans, but he said, I need you to execute. And he said, you also need to be honest enough to come to me and tell me what you need. Well, if you remember early in the pandemic, we had the governor of New York screaming for thousands of ventilators.
Right.
And I think he was doing that in good faith, but he was being informed by people who were in a worst case scenario, saying, you might need 16,000 ventilators.
Mm-hmm.
Well, there wasn't that many in the country. And should we give them all to New York City? And there were some tough issues that had to be tackled, and only a cabinet secretary could take those on. And I think Secretary Wilkie did a spectacular job in responding to my needs. And so I went to him to decompress. He's the guy that would come to me and say, what time are you going home tonight? Mm-hmm. And what became 23, 24-hour job, he was very effective. Now let's go back to family. My wife is a veteran. She's an Army veteran. I met her in the Army. She was driving a 5-ton truck when we met.
That's hot.
She had an extraordinary understanding of the stress of service, and as part of, after September 11th, 2001, there wasn't a year that I wasn't gone. I think at least 170 nights. Until I retired in 2014. And, that can strengthen or weaken a relationship. For us, it strengthened us. And I think that those are the sort of things that helped me, get through this. And so my chain of command, both inside my family as well as inside the VA, was extraordinarily important. And you see the people around you and your veteran friends and in your own lives where family's important. Clearly, look, your dad's flag is behind you, right?
It's 100%. Yes, and my mom's picture's there with it, just because they're both that same hard charger.
But your family is part of your resilience in life, okay?
Yes, sir.
And so is your spouse. And when you think about with your listeners, there are listeners that have resilience, and there are those that are really teetering on the edge. And what we need to do as veterans is to make sure we're reaching out to all of those that are teetering on the edge and helping them strengthen their foundations and to get the resilience that allows us to go forward. And I would imagine, Brad, if you're having a bad day, if I said, get the snowboard, let's get up on the mountain. When you came back off of that mountain, you may be sore and tired, but you're going to say, it's going to be okay. Whatever I thought was
That's
important
right.
may not be that important. I found balance in my life. And that goes back to tying in, the whole concept of recreational therapy that you asked about earlier. There's things that stabilize us, that give us resilience. And I was able to be the calm in the middle of the storm because of those anchors in my life. Now, look, I lost my dad to COVID. I lost my brother to failing to go to the emergency room for a gallbladder because he was afraid of going into an emergency room where there was COVID, and gallbladder ruptured and he died. my youngest son had bilateral COVID pneumonia. He was in Florida. I was in DC. We were separated for weeks when they were trying to treat him in the hospital. So I think there are things, though, that, I'm a person of pretty deep faith. And, I think God puts certain things in front of you that really challenge that stability and that resilience. And I think that we find strength in each other. And it's what I love about the veteran community and why I want to continue serving them is that we as a community are together. And that's really important. And clearly, Red, I hit a nerve, and I'm sorry.
No, it's okay. I mean, we all have things close to us that where we lost people, and I'm sorry that you lost your father and your brother. And I'm just a guy like that has feelings. So yeah, maybe a little nerve. And my dad, I think about my mom, and they're here with us. So sorry about your dad and your brother.
Thanks.
And you can hit my nerve anytime, okay? Because underneath all of this beard and all of this right here is just a person that has feelings and that just wants to see everybody have a good time and, and just peace, really, if we have to, if we could say it. But I know that guys like yourself, guys like my father, my grandfather, World War II veteran, these guys chose to go and serve in World War II. My dad didn't want to be conscripted. He chose the Navy. You see, in the draft, okay? And he was 17 when he went. And he was adopted, and he didn't know who his dad was. And I found out later in life through DNA who his dad is. And his dad was leaving Vietnam as my dad was entering Vietnam like the same year. His dad was National Guard, and my dad was joining the Navy at 17. And I was just like, it's crazy. So when you bring up family, and I bring up a support system, and you're talking about veterans on the edge, and there's a support system for you. And if you don't have a family to reach out to and you're listening to this, you can reach out to me directly at my Instagram, radrockin. And if you're a veteran and you want to hit up the VA, don't be scared to hit up the VA and say, hey, I'm feeling funny about myself. I'd like to come in, maybe talk to somebody. Do you have Rad's phone number? Feel free to reach out to the VA. I know you don't want to call like the local law enforcement. They're not the ones coming to help you. You want to just hit me up. If you're freaking out, hit me up. Whoever you are.
Red, thanks for doing that, and I so appreciate it, and I appreciate the time that you've spent with me today, and I appreciate the friendship as only can occur between two veterans.